and welcome to our latest presentation on susceptibility to severe COVID-19 infection. Who are vulnerable to the severe infection in COVID-19? SARS-CoV-2 or COVID-19 has changed our lives like never before. One of the most pressing questions in front of us is to find who is susceptible to severe infection. Up to 40% of the infections may be asymptomatic, suggesting that a large proportion of the patients are already protected to the disease. On the other hand, there is one spectrum which is the severe disease with a case mortality rate of around 30 to 40%, while the overall case fatality rate in COVID-19 remains nearly 1%. Interferon type 1 is one of the important armamentariums or cytokines which help our body in getting rid of the virus. This primarily acts through two receptors, that is the JAK-STAT pathway, where it influences the nuclear integration and replication of the viral particles, and through the cytosolic components like interleukin related factors. So what we are going to discuss is the defects in the type 1 interferons in some susceptible individuals resulting in severe infection. So there have been two recent papers which have been published. The first one is the paper on inborn errors of type 1 interferon immunity in patients with life-threatening COVID-19. Here we can see that the inborn errors in type 1 interferon can affect three loci, primarily the toll-like receptor 3, interferon related factors 7 and 9. The affection of these pathways results in reduced effect of the type 1 interferon and increased viral replication. And these deficiencies or inborn errors in the metabolism are found more commonly in patients with life-threatening infections, and they are not at all found in patients who had a mild or asymptomatic infection. So in this study, they concluded that at least 3.5% of the patients with life-threatening COVID-19 had some deficiency in the interferon type 1 effect in toll-like receptor 3 and IR7 dependent induction and amplification. These genetic defects made these patients susceptible to a severe infection. This also reveals that the double-stranded RNA sensor, that is toll-like receptor 3, and the type 1 interferon cell intrinsic immunity is extremely important to control the SARS-CoV-2 infection. And type 1 interferon administration may be helpful in controlling severe SARS-CoV-2 infections. The second study is on the autoantibodies against type 1 interferons in patients with life-threatening COVID-19. The rationale of this study was that B-cell autoimmune infectious phenocopies have three inborn errors of cytokine immunity which exist and in which there are neutralizing autoantibodies against interferon gamma, which results in mycobacterial infections, interleukin 6, which results in staphylococcal infections, and lastly, interleukin 17A and 17F, which mimic the clinical phenotype of germline mutations of genes that encode the corresponding cytokines or receptors. So here we see the effect of type 1 interferon in the immunity on the left side, while on the right side we can see the presence of the autoantibody results in reduced effect and increased viral proliferation. So in this particular study, in 663 mild and asymptomatic patients, they did not find any autoantibody, while up to 10% of the patients who had a life-threatening or severe COVID-19 infection had these autoantibodies against interferon type 1. And as we had already seen in our previous studies that male sex and elderly patients are more prone to a severe infection, this is further established over here with only 2% of the females having these autoantibodies, while 12% of the males having these autoantibodies. Similarly, there was a higher proportion, that is 13% in age group more than 65 years who had these antibodies. All these were statistically quite significant. So what is the take-home message from these two studies which have been published last week? Interferon type 1 is crucial in immunity towards COVID-19. Inborn errors in its metabolism and antibodies to type 1 interferon can be a cause of severe illness. These studies provide means of identifying individuals who are at risk of developing life-threatening COVID-19 infection and ensuring their enrollment in vaccine trials. They can also help in explaining more severe illness in especially the males and elderly population. Plasmapheresis, plasmablast depletion, recombinant type 1 interferons not targeted by autoantibodies may be therapeutic options in the future in severe patients, especially in the early stage of the disease. Thank you for your patience and check our website for further information.